Good afternoon. My name is Cristina Luís, and I'm from the Faculty of Sciences, University of Lisbon. I belong to the Inter-University Center for the History of Science and Technologies. And it is a pleasure to be with you at this meeting and festival about the art of aging. And my presentation is going to be about how to be active and engaged in citizen science. But what do we mean when we talk about citizen science? What is citizen science? Citizen science is in fact an emerging concept, and for the past 2 decades, there's been subject of great discussion. The oldest known reference regarding the use of citizen science dates back to 1989. It was the first time, as far as we know, that this term was used. It was used to describe the efforts of volunteers in the United States to collect rain samples to help the Audubon Society in an awareness campaign about acid rain. As you can see here, it showed up in this publication from the MIT Technology Review. So as far as we know, this is the first time that the term is mentioned, that the term citizen science is used. The term was subsequently used extensively and defined by Alan Irwin, a sociologist, in its 1995 publication. In this publication, actually entitled Citizen Science, a Study of People, Expertise in Sustainable Development, the way Alan Irwin defines citizen science is more a reflection on the participatory ideals of the 70s than what we currently understand as citizen science. So the most relevant definition of the term, which meets not only the terminology used in the 1989 article, but also the current meaning of citizen science, emerges from an article that was published in 1996 by the American ornithologist Rick Bonney from the Cornell Lab of Ornithology. In this definition of the term, Bonney says that citizen science is a set of scientific projects in which amateurs provide data, for example, bird watching data, to scientists acquiring new scientific capabilities, that is a two-way street. In a white paper on citizen science that was published in 2014, the definition of the terms is the involvement of the general public in scientific research activities in which citizens actively contribute to science with their intellectual effort, with their knowledge, or with their tools and resources. Overall, we can call and can define citizen science as public participation in scientific research. That is, when people without any formation in science or without any formation in a particular field of science participates in the research process, either in the definition of the research question or in data collection or data analysis, or even in more developed phases of the research process, as is the discussion of results, communication of results, conclusions, and the creation of new questions. So it's when we have a public participation in scientific research, that's what better describes what citizen science is. In terms of topologies of projects or initiatives that exist in citizen science, we have the contributive type, the collaborative type, or the co-created type. There are other types and sections of citizen science, but these are the most known ones. So the contributive type of projects are usually designed by scientists, and it is where citizens contribute with data. Then we have the collaborative type. They are usually designed by scientists, and citizens can contribute with data, but they can also help improving the design of the project, analyze data, or even disseminate results. And the co-created type, which is the type of projects that is better to create. They are designed jointly by scientists and citizens, and in which some citizens are actively involved in most or even all steps of the scientific project. There are less projects from the co-created type and more projects from the contributive type, but it would be better to have more of the co-created type, since it increases engagement and involvement of non-scientists in the scientific process. So overall, citizen science enables faster progress in scientific research. It contributes to increased understanding and knowledge about scientific aspects. It also increases public involvement in scientific activities and contributes to the development of research skills. So citizen science has a huge contribution to the improvement of science with the participation of citizens. So how can older adults participate in citizen science? It will be, and how can they be active in citizen science? It is known that in 2030 that there will be 1 million of older adults globally. That is 12% of the total population. Across the planet, the number of older adults is growing faster than the number of people in any other age group. We can expect 150 expansion of the population aged 65 and over in the next 35 years. And worldwide, the population with 80 and over is projected to more than triple between 2015 and 2050, from 126 million to 446 million. So it's a population that is increasing. The World Health Organization notes that reducing severe disability from disease and health conditions within this age cohort is one key to constraining health and social costs. It is recommended that specifically targeted policies are created to address the needs of older adults, to include housing, employment, healthcare, social protection, and other forms of intergenerational support. The evidence of the benefits of physical activity for the prevention and management of chronic conditions for older adults is well documented. It confers benefits for psychological health and mental well-being, functional status outcomes, and social outcomes. So increasing physical activity is really important for older adults. Moreover, social connectedness is vital for active aging. Social ties help humans build resilience in the face of various hardships and help to extend their lives. They can matter even more as we age, when ill health increases, which can diminish opportunities for social engagement. So social ties influence health behaviors and physical health. Moreover, in terms of physical environment, the associations between neighborhoods and health have been reported to be the strongest among adults around retirement age. And the positive impacts, for example, of walking on older adults' strength and flexibility supports the value of walking in warding off disability and extending older adults' capacity for independence and aging in place. So, having this overview on how older adults need to increase their physical, improve their physical status, their physical activity, their social connectedness, citizen science can have, in fact, a value on this. As an example on how citizen science can connect with older adults, I will be talking about a model, the Our Voice Citizen Science module, that is to empower residents regardless of geography, age, or socioeconomic and cultural backgrounds, to activate health promoting changes in their local neighborhoods and communities in collaboration with relevant community organizations and academic partners. It is a model that was developed by the Stanford University, and it has several steps, several phases. In the discover phase of this approach, citizen scientists that can be, in fact, older adults, use a simple mobile application called the Stanford Healthy Neighborhood Discovery Tool, DT, to document local environmental features through geocoded photographs, audio narratives, and walking routes. The DT is user-friendly across all levels of education and technology literacy, which is really nice, and has been operated successfully by persons aged between 10 to 92 years old. So it's a very easy to use tool. In the facilitated discuss phase, citizen scientists review and analyze their own data, the data that was collected with the discovery tool, and in order to collectively identify and prioritize the challenges. Next, the group then moves into the activate phase, brainstorming potential solutions and working with local community partners to develop and advocate for realistic low-cost changes to local structures, policies, and practices. This process gives participants a voice, a means of telling their stories, building consensus, and motivating action. So our voice model blends the active participation, participant engagement and ownership inherent in community-based participatory research with the standardized participant-based data collection methods that are a hallmark of citizen science. This approach allows citizen scientists to merge individual storytelling to represent collective experience and advocate for changes, so the final phase of this model, that will impact both individuals and their communities for better. The Our Voice citizen science model has been applied or is currently being tested in over 20 countries across 6 continents in response to a range of local issues that can impact health. In Portugal, we are also seeing how it can be implemented, and it will be following the same stages as in other countries. A major goal of Our Voice projects has been to engage underserved populations that typically have lacked a voice in decision-making related to their local neighborhoods and communities. So the promotion of health equity, for example, everyone has a fair and just opportunity to live the healthiest life possible, is the principal theme of this work. So I'm now going to provide a few examples, a couple of examples of our voices and how it has been implemented in worldwide. The first example is a project that was developed in San Jose, California, where they created a convenient multi-generational physical activity and recreation opportunities. So in a multi-generation project that included 15 adults and youth in the Mayfair area of San Jose, California, the community-based Somos Mayfair nonprofit organization that is partnered with Stanford researchers and the Santa Clara County Public Health Department to identify barriers and develop solutions to promote active and safe living in this ethnically diverse, historically underrepresented area. The data that the residents collected using the discovery tool and around which consensus was subsequently built were presented to the mayor of the city of San Jose and city council members. So among the successes that occurred from this project were the development of memorandum of understanding with the local school district to allow residents to access a local soccer field, for example, the designation of scholarships for enrichment programs at the local community center, or, for example, the creation of walking routes aligned with historical aspects of the neighborhood and resident-led walking groups, as well as physical activity programming. So the results of this project show how resident-centered, data-driven methods can provide a means through which historically undeserved residents of all ages can work effectively with local decision makers and researchers to address long-standing social and environmental disparities that can impact health and their locals. So this is a good example of interaction between several participants can improve conditions of people. The other example I bring is the creating safe, senior-friendly social spaces in Xijin, Taiwan. The Our Voice discovery tool and citizen science process was used to capture all the adults' perspective about their local environments in a contextually valid manner. 15 older adults, around 70 years old, living in Xijin, a small community in southern Taiwan, used this tool during their walks in the village to capture barriers and enablers to healthy aging. A total of 78 photos and audio narratives were collected. Issues that were identified by the citizen scientists included lack of public spaces for all older adults to gather and socialize, for example, or abandoned buildings, a dysfunctional sewer system, cracked and broken sidewalks, and personal safety issues that were related to motorbikes and other factors. During one facilitated resident meeting, residents prioritized abandoned buildings and personal safety as high priority issues that they would like to see addressed. Afterwards, residents met with local village officials to share results and brainstorm potential solutions. So an abandoned building was identified to turn into a community center where older adults could safely gather and socialize. So this is another good example how interaction and participation can improve quality of life. A longer-term goal and how this ongoing engagement with citizen science can be kept. The Our Voice Global Citizen Science Research Initiative and Network represents a promising approach to building age-friendly communities for older adults and other residents, irrespective of the circumstances, locations, or cultures in which people live. Our voice may help to accelerate the adoption of implementation of contextuality, relevant, feasible, and sustainable community change to foster healthy aging. So a long-term goal of this global research initiative is to build an interactive world map of resident collected data and project results along with other resources that can be shared by researchers, non-academic and government organizations and residents alike. This type of collaborative undertaking can help to advance the vision laid out by the World Health Organization and other organizations in building a true path to achieving global age-friendly communities, along with health equity in other resource communities and beyond. So this is a very good example, and I brought it here because it can be reproduced, it can be replicated, it can be promoted in collaboration with Our Voice or not. But this is a very good example how citizen science and older adults can be interconnected, and how research and improvement of quality of life can be done. But as another example, and as an example of how older adults can actively contribute and participate in gathering information for scientific research, I bring the example of senior citizen scientists watch for insects in Virginia. In the example of Jim Wagner, a resident in Alexandria, Virginia, which began keeping track of insects like dragonflies, butterflies, and moths over 25 years ago. Now, he leads a group of senior citizen and citizen scientists who meets every week from April to October to count the insects they find in Northern Virginia. Last year, they logged 43 surveys and 1,569 volunteer hours. So even the stay-at-home orders briefly interrupted their outgoings this spring, but they're back individually to resume their work. So a Georgetown University team that studies butterflies has begun collecting and analyzing their data and put into a network for researchers worldwide to access. They also shared their work at the citizen science platform called Naturalist. Wagner says that he hopes that their work will shed light into the catastrophic decline of insects globally. And he read that the publication by the US Geological Survey that said that if a few people will over time look at the same places over and over again, that the outcome is bound to be important. So Wagner recognizes the importance of contributing and participating and contributing with data for scientific endeavor. In this type of projects where people are asked to contribute with data for science, ongoing and considering ongoing engagement of these citizen scientists, it is very important to consider the continuous feedback and encouragement during data collection. Also, some trials at further analysis with individual data, that is, show that the work is in progress, and also co-design through feedback and discussion with all citizen scientists around on how to improve the process and future potential. So if we want to consider participation of older adults in citizen science, continuous dialogue and continuous collaboration, continuous feedback is essential. And everybody can gain from this long-standing collaboration. So thank you very much, and I really hope you like this presentation. My email is here in case any more information or discussion is needed. Thank you very much once again for the invitation to be part of this so important and so interesting conference and festival. Thank you very much.